I would say this particular group of patients, they're wonderful people, but they seem to be really run by their symptoms. Their symptoms have way more control of their life, and they have a little less control of their life. They may get a headache, and instead of you or I thinking, oh, it's just a headache, it's going to pass, their first thought is, oh, maybe it's a brain tumor, and I need to do something about it. So they kind of sometimes will move to thinking the worst.
They explode their problems so that they're very serious. And they have a hard time focusing on anything else, and actually sometimes hard time functioning because they're worried so much about these things going on with their body.
I see patients that, do have high blood pressure, but they come in worried about their high blood pressure, and that actually makes their high blood pressure higher. They do have true symptoms, chronic abdominal pain, but the way they think about their abdominal pain actually makes the pain worse. And it's difficult to know what to do with those patients. How can I help them?
These patients always kind of present a challenge, and I think they never feel really good about the visit when they leave, and sometimes the providers, we don't feel very good about the visit when they leave because they keep coming in with new symptoms or have a myriad of symptoms that we just keep continuing to do a workup on. So we keep ordering tests sometimes, even when we think there's really not going to be anything we're going to find. We know there's a risk with ordering more tests, but you kind of feel pushed to do something for these patients. And so we sometimes order additional laboratory tests, sometimes additional imaging studies. They frequently end up going into the emergency room repeatedly because they have these overwhelming symptoms that scare them.